Hello and welcome to Cumbria Hyperbaric. Thank you for taking a few minutes to learn more about us and our vision for the Cumbrian and wider Northwestern community. In this presentation, we hope to answer any questions you may have about hyperbaric oxygen therapy, also known as HBOT. We hope to capture your imagination and sense of hope with a view to ongoing engagement in the community and introduce hyperbaric oxygen therapy to those who may not have heard of it before now. I discovered the fascinating subject of diving science in 1994 when I became a diver, and by association I was introduced to diving medicine. This was followed by my progression into technical diving in 1997, my Dive Master achievement in 1998, and the commercial diving field in 2003. It was the book by Dr. Carl Edmonds, Diving Medicine for Scuba Divers, that really caught my interest when I was learning the mechanics and theory of mixed gas and deep air diving between 1997 and 1999. At first, hyperbaric technology can appear intimidating and looks more like high-tech space-age technology. While the same technology is indeed used in space exploration and the exploration of the deepest seas, it is in fact a very old technology dating back to the 1600s, and it isn't quite as complicated as it seems. You may be familiar with other names for hyperbaric chambers, such as diving chambers, pressure chambers, barochambers, and decompression chambers, and their use in the treatment of diving casualties and decompression sickness, also known as the bends. Over the last 100 years, scientists and medical professionals, as well as divers and dive supervisors, have observed a link between accelerated healing and greater well-being with the use of these diving chambers. From the caisson workers under the East River during the construction of the Brooklyn Bridge from 1869 to 1883, to the discovery by French physiologist Paul Bert in 1878, which connected decompression sickness to nitrogen bubbles in the tissues and bloodstream, and for over 100 years people have been applying the principles of hyperbaric oxygen therapy to patients and divers with remarkable success. In fact, the first hyperbaric chamber, known as the domicilium, is said to have been created by British clergyman and physician Nathaniel Henshaw in 1662. Henshaw is known for his belief in the benefits of and his work in fresh air therapy. Although this is disputed by author Richard Clarke in his 2024 paper entitled Nathaniel Henshaw, Not History's Pioneering Hyperbaric Practitioner. Although he does agree that Henshaw was the first to conceive of the idea, Europe witnessed the use of hyperbaric oxygen treatment as a spa and well-being therapy in the 19th century. Pressures of 2 atmospheres absolute were commonly used. That's correct, it's not a recent fad of the wellness sector at all. The French led the discipline as early as the 1830s. The French have a long and impressive history in diving medicine and technology, and have contributed significantly to its development in the Western world from before the days of Jacques Cousteau. In the 1930s, the military began testing the use of HBOT to treat deep sea divers with decompression sickness. And the history goes on. Almost any website promoting the use of hyperbaric oxygen therapy will detail what is repeated here. Hyperbaric oxygen therapy was first reported in The Lancet in 1887. What is HBOT? Hyperbaric oxygen therapy, or HBOT, is the administration of pure oxygen or other enriched mixes breathed through a mask or hood at higher than atmospheric pressure. This is facilitated by and delivered in a pressure chamber, also known as a baro chamber, diving chamber, or hyperbaric chamber. The extra pressure results in far higher concentrations of oxygen in the bloodstream and subsequently the tissues it feeds, with some reports stating as much as 20 times the amount depending on purity of the mix being breathed, and pressure. Increased oxygenation upregulates the natural repair and rebuild processes in the body simply by altering the environment. It is non-invasive and very safe when administered properly and within guidelines and accepted practice. This leads to accelerated healing and healing, where no previous healing has been observed, from a wide range of ailments. Basically, any condition that can benefit from improved cellular respiration and greater oxygen saturation in tissues could benefit from the hyperoxygenation associated with the therapy. Studies establish that HBOT can and does benefit most conditions relying on oxygenation for their recovery. These include, but are not necessarily limited to, Accelerated healing, including sports injury, wound healing and problematic wounds, brain injury, including acquired brain injury, traumatic brain injury, mild traumatic brain injury, and concussion or subconcussion syndromes, and birth injury. Circulatory and vascular complications, including compartment syndrome, burns and thermal injury, and arterial insufficiencies, including severe anemia, inflammatory conditions, including arthritis, multiple sclerosis, trauma, post-surgical recovery, and depression. Toxicity, including substance abuse, accidental poisoning, and carbon monoxide poisoning, PTSD and pain syndromes, radiation injury, chronic fatigue syndrome, and act as a preconditioner for rapid recovery from surgery. HBOT can further be used as an adjunct therapy in the treatment of diabetes, cancer, cardiovascular disease, liver disease, brain injury, cerebral palsy, alcohol and drug addiction. It also helps those who have had difficulty sleeping. Sleep is often referred to as the elixir of life. Without it, natural healing and repair simply does not happen as it should. It is also useful in the treatment of damaged livers and brains of recovering alcoholics and drug addicts. Oxygen plays a key role in the healing and repairing of damaged cells in our bodies, but often the flow of oxygen is blocked following injury or disease, and the healing process takes much longer. All cells benefit from exposure to oxygen. For example, a cut on the knee will heal more rapidly if exposed directly to the air. Evidence suggests that hyperbaric oxygen therapy may have a role in rejuvenating and rebuilding patients' brains, and hence their lives. Research in centers such as the Sagol Center in Israel has produced amazing results in this regard. A hyperbaric chamber can supply more oxygen to the brain, stimulating the production of new blood vessels and reducing inflammation known to be characteristic of a number of conditions, including multiple sclerosis, for example. It protects the blood-brain barrier as well. New research shows that increased oxygen flow in the blood can result in the awakening of dormant cells in the brain and the creation of new ones in a process known as neurogenesis. The increased oxygen can rejuvenate cells which have not died but don't have enough oxygen to function normally. This tissue is called the ischemic penumbra. This recovery envelope is relevant for most neurological disorders, including brain injury and neurodegenerative disorders. How does it work? What are the mechanisms in action? Under increased pressure, more oxygen is able to dissolve into the bloodstream. The difference between regular oxygen therapy and hyperbaric oxygen therapy is that it allows for an almost unlimited amount of oxygen to dissolve into the plasma and not be limited to that which is only attached to the hemoglobin. The only limiting factor in how much oxygen can dissolve in the blood is, of course, the pressure. The plasma is able to carry many times the oxygen than the red blood cells do when under increased pressure. When we breathe, a difference in oxygen pressure exists between the oxygen in our blood and the oxygen in the air. This is what facilitates what is called gas exchange in the lungs. It's the fundamental mechanism which allows breathing in organisms with lungs. By increasing the pressure, we increase the difference in those pressures, and according to the long-established gas laws, more oxygen dissolves into the blood. Further facilitating this is that we breathe 100% oxygen, or close to 100% in a chamber, rather than the 21% found in normal air. This means that not only is there 5 times the concentration, but in some cases up to 3 times the inward pressure. This results in 15 times the amount of oxygen dissolving into the blood and tissues where it is consumed. This means that under normal conditions and pressure, an average adult consumes as much as 2.7 kilograms a day, of which only 900 grams is absorbed into the bloodstream. Remember that in a hyperbaric chamber, we breathe up to 15 times that amount, equaling a total of absorbed oxygen of 13.5 kilograms for a 24-hour period. For a 60-minute session, this is equal to 560 grams in a single hour, compared to 37 grams in a single hour under normal pressure. As this increased amount of oxygen in the blood travels through the body, it then, in the same way, dissolves in far greater amounts into tissues, cells, and cellular fluid. This then allows cells to function optimally and upregulates many repair and rebuild cellular functions, including genetic signaling required to trigger repair processes. It allows for greater energy creation and uptake and increases metabolic function. It stimulates blood vessel growth, cell growth, collagen development, both osteoblast development for damaged bones and fibroblast development, which is essential for wound repair. What is an hyperbaric chamber? The typical hyperbaric chamber is a hard-shelled structure, rather like a section of a big metal pipe constructed from steel. They are similar to the hyperbaric chambers used for divers with decompression sickness. Such chambers can be run at absolute pressures of up to 6 bars, but the usual therapeutic pressure is around 2 to 3 bars. We usually measure this in atmospheres absolute. Is it really safe? Professor Philip James, Emeritus Professor of Hyperbaric Medicine, formerly of the University of Dundee, is quoted as saying, quote, "To be in a hyperbaric chamber is to be in the safest place in a hospital, as breathing such a high concentration of oxygen, a patient cannot suffer a stroke or heart attack. It would be difficult to find a patient killed by oxygen in a year, but of course there are plenty of deaths from lack of it." Unquote. Chambers offering Type 3 services used by the many similar charities in the UK are considered so safe that their use was deregulated by an Act of Parliament in 2008. They are no longer required to be Care Quality Commission registered when therapy is not administered by a medical professional registered with the GMC. Medical units still need to register when the therapy is administered by, or supervised and directed by, a registered medical professional. Each session should be monitored by specially trained technicians. Visual communication should be ensured by CCTV, and audio communication is provided by an open-line intercom system. What are the benefits? Hyperbaric oxygen therapy can be used as a complementary and adjunctive therapy for the treatment of a wide range of diseases such as diabetes, multiple sclerosis, cancer, and Lyme disease. The various benefits of HBOT are still being discovered by medical researchers. Evidence shows that HBOT curbs infection and promotes the growth of new capillaries and blood vessels to areas of poor circulation, which is particularly useful for those with diabetes and compromised vascularization. It also boosts collagen formation and is very good for the complexion, and is often used as an aesthetic and beauty treatment. Similar physiological processes are responsible for accelerated wound healing in soft tissue and bone alike. Hyperbaric oxygen therapy helps clear the body of toxins through upregulated metabolism and can be a useful component of drug and alcohol detoxification, as well as other occurrences of poisoning. Oxygen is the natural antibiotic of the body. It controls over 300 genes and increases stem cell release and stem cell cascade. It helps damaged bodies to recover by accelerating the healing process and extending the healing envelope. In short, any condition that can benefit from greater oxygen saturation in tissue will likely benefit. In fact, it would be surprising if it did not. Many conditions are a cause and even a result of inflammatory response, and hyperbaric oxygen therapy is a great anti-inflammatory. In short, HBOT is a simple, non-invasive and safe therapeutic modality which can benefit and upregulate the oxidative process in the body, which is the basis for healing, and indeed all cellular life. HBOT is nowadays considered a therapy no longer just for divers. For more information on the technology and science of hyperbaric oxygen therapy, visit our website where there's plenty to read for free, or inquire about our online or direct knowledge development and training programs prepared by me, Hayden Dunstan. I look forward to engaging in the future. Thank you for watching, and goodbye for now.